Hi everyone, welcome to the Addressing Mental Health Inequalities in Minority Ethnic Groups briefing event. I know it's quite a mouthful. Thank you for coming today and good morning everyone. Just a reminder before we start, the event today is being recorded, so please feel free to turn off your cameras if you'd like, and we ask that you could please pop the mute button as well. So the purpose of today is to really get a good understanding of the fund, and we want to help you make successful applications to the fund. There'll be a Q&A opportunity near the end of the presentation, and that's for you to ask any questions that you may have, or if you prefer, we can also do sort of in-depth questions later as well. Okay. So my name's Helena Bassi. I'm one of the grant officers here at Leeds Community Foundation, and I'm joined today by my colleague Shahed Mulvey, who is our head of grants. I'll go through a little bit about what Leeds Community Foundation do, who we are. Some of you may have heard of us before and worked with us before, and some of you may not have. So we are a community foundation based here in Leeds. We're part of a national network of affiliated community foundations across the UK. We call it UKCF. Collectively, we have given out £1 billion in grants, and that's been given out since foundations began in the UK. Across the network, we have £692 million in endowments across the network, and we have £98 million given in grants in the year 2019 to 2020. Combined, all of us as community foundations, we're the fourth largest UK grant maker in the UK. So that's a bit about what we do. Each foundation will work differently. For Leeds Community Foundation, we also cover Bradford and sometimes Wakefield and other areas, but mainly we focus on Leeds. A bit about what we do, Leeds Community Foundation. So we inspire businesses and private donors to give money locally. We work with different partnerships such as the council, or sometimes donors, businesses and companies. We work together to give out that money efficiently to high quality community work supporting local people. And we have experts in our patch which give an overview of the need and practical vehicle for action. So we work to ensure that Leeds is a city of opportunity for everybody, and we look at different needs in different areas, and we work together with local communities and businesses to address that need. And we distribute that in grants as well. So we've been working really hard this year. It's been a very interesting year with COVID-19. Just a bit about the support that we have delivered. So we've awarded all of our COVID-19 response funding for small local organisations. We've also provided wraparound support for organisations to adapt their model and plan for the future through the Resilience Fund. So that was a good fund to help support groups in terms of their capacity, but also sustainability and the resilience. We will soon be opening a larger grants fund focused on infrastructure support in light of COVID-19. And we're also working very hard to secure further funding for COVID-19 response and recovery grants. This briefing today is about our business as usual programmes, funding day-to-day projects and day-to-day work that make Leeds a great place to live. We will also continue to be flexible in terms of the needs for third sector organisations in delivering these projects, with flexibility around the start date, project adaptations and reporting wherever possible. There is a question in application forms as standard, just to say how you may adapt the activity or the work that you're doing in light of COVID-19. And as we've seen, it's been quite unpredictable. But we want to be flexible and want to be supportive to organisations to still be able to continue to deliver work. So we're here. If you would like more information about COVID-19 and our response and work that we have got coming up, and you'd like more information, then we ask that you please contact us. Our email address is just there. It's grants@leedscf.org.uk. Okay. So we'll start on this funding programme, which is addressing mental health inequalities in minority ethnic groups. And we're going to go through the event and just go through the criteria, what we would expect to see in applications, and then a Q&A near the end. So we'll start with who can apply, who's eligible to apply to the fund. So we can accept applications, from community groups, charities, social enterprises, or other charitable organisations from the third sector. And we ask that these groups and organisations, they must have a constitution or other relevant governance document. The document usually details the charity's purposes, their objectives, what they'd like to do to achieve their aims. Also includes trustees, powers and meetings and so on. Most importantly as well, it also explains, just in case charities do close or groups close, a dissolution clause. So what would happen to funds if that was the case. We also ask that groups and organisations have a management committee or a board of directors or trustees of at least 3 unrelated people, and they must not be living at the same address. To be eligible, you must have a bank account under the name of the group with at least 2 unrelated signatories. And to be eligible for this fund, you must be based in or supporting people living in Leeds metropolitan area. Unincorporated groups, so groups that are not registered as a charity or a charitable incorporated organisations or a community interest company, you can apply to the fund, but the maximum grant available would be £5,000. We ask all groups to have relevant policies in place. So if your application involves working with vulnerable adults, we would ask that you have a vulnerable adult policy in place and that you submit that along with your application. If you're working with children and young people, to have a children and young people safeguarding policy with clear actions and DBS checks, disclosure procedures. And all organisations must have an equal opportunities policy as well. So with the partnership applications, we do want the fund to be accessible and open for everybody to apply. Partner applications, larger organisations with an annual income can apply as the lead and responsible body, as long as the work and support for smaller organisations, example delivery, governance, capacity, or evaluation. The respective roles of each partner will need to be outlined in the application. At the top of the application form, there's a section for partners, and if you could explain the roles within that part there. In such cases, the larger organisation would need to take around 25% of the grant, and the 75% remaining would need to go to the smaller partner organisation. The larger organisation would be responsible for submitting the reporting, ensuring the budget is distributed as needed within the partnership. If you are applying as a solo applicant, you must have an income of less than 300,000 in the most recent financial year, if registered or incorporated. We are keen to fund grassroots organisations with this fund, and we are keen to fund organisations that don't solely work us within a mental health setting. We want to be able to fund, organisations within the third sector to open up and explore and meet that need and issue. Unincorporated groups must not have an income exceeding £10,000 in the last financial year. Larger organisations may act as a partner organisations and receive some of the funds if that is the case. So to be a solo applicant, you must have an income of less than 300,000. If you're an unincorporated group, you must not have an income exceeding £10,000. If you're not eligible with those two, then the opportunity is there to work as a partner application. The application process is similar to some of our other funds. We have the full information is available on our website. Open Grants, you'll find a list of all our funding programs there. The full criteria is available on that page too. We ask that you please read the criteria in full before applying to us. The process is, it's an online application form. and supporting documents, governance document, financial accounts, management committee and policies, they should be attached with the application when you submit. And just to note, there are word counts on the questions as well. So we don't want you to lose any of the work that you're doing, or if you're copying and pasting, just to double check. And ask that you save as draft, and that will save the work that you have done, and then you can go back to complete it.
Sorry, Helena, I just want to double check, can everybody hear Helena speaking?
Oh.
It's just that we've got a message in the chat from someone saying they can't hear anything.
Yeah, I can.
Yes, I can as well.
Okay.
Yeah, I can hear.
I can, yeah.
Loud and clear.
Yeah,
Me too.
I can hear.
Oh, great. Okay, so Honeybee, whoever that is, it must be a problem at your end.
Yeah.
Sorry about that.
Don't worry, thank you. Sorry,
Okay,
I thought that was me then. I thought,
no, sorry about that. Just thought I'd double check.
Don't worry, it's temperamental internet. Okay, I'll continue through the presentation. Yeah, so there are word counts on the questions, so yeah, just check that before you submit your application. You can discuss your project with us. If you've got any questions or queries, or if you've done something by us, please feel free to contact us. We're not in the office at the moment, but we are still here. You can email us at grants@leedscf.org.uk. We're also working in partnership with Public Health Leeds, who can also go through application and offer support as well. There'll be some more details about that later on in the presentation. Once you've submitted an application, we will acknowledge the receipt of that, and you will have a draft there. Sorry, not a draft. You'll have the final copy of your application for your records. It will then move into the assessment phase, and we will assess your application. We may need to contact you if we have any questions, or if we just need to check something. And if you're a new applicant to us, we'll also check a reference at this point. If your application is shortlisted, it will be submitted to a decision awards panel for further consideration, and they'll deliberate and they'll make the final decisions on funding. Okay, so that's the eligibility and the application process. I'll go through the criteria in a bit more detail about what the fund can support, what the aims are, and what the objectives are. So we'll start with a bit about the fund and how it sort of came to be. So we do work closely with our partners, and we understand Leeds, as across the country, people from minority ethnic groups, they are sadly more likely to experience mental health problems and less likely to receive good quality, timely support that meets their needs. It's also been noted that children and young people from minority ethnic groups are underrepresented in mental health support services. They have reported a lack of trust in mental health support, as well as barriers to access support for mental distress. Adults from minority ethnic groups have an increased risk of experiencing severe mental illness and overrepresented in community treatment orders and admissions to mental health wards in crisis. So we can see a real need in the city, and as part of a broader programme of work to try and reduce these inequalities, a new grants programme, this one, has been launched, and the aim is to fund local third sector, social enterprises, community groups and charities to support local people from minority ethnic groups with their mental health. The fund has been established in partnership with NHS Leeds CCG, Leeds City Council and Leeds City Council Public Health and Synergy Collaborative Centre. So some of the areas of work we are looking to fund for this fund is we would like projects to build capacity of grassroots organisations to work in a psychologically informed way, and that means to take into account the psychological and emotional needs of the people that they wish to work with. We'd like to fund areas of work where they are increasing awareness of mental health services and supporting people to overcome barriers to access those services. This can include reducing stigma and increasing trust with services and support. We'd also like to fund work where they are offering a safe and a trusting environment and space for people to ask for help and to receive support for their mental health. And using trusted relationships to help people access that mental health support from other services professionals if they need it. So breaking down the barriers and increasing access to services and support. So to submit a successful application, we ask that work and projects, they should address one or more of the following. So that's building capacity, reducing stigma and increasing trust, increasing access to early intervention for development, mental health issues, influencing positive community action and promoting community resilience. We will be awarding some of the grants to work with adults, some to work with families, and some to work with young people and children. Just to run through some examples of things that you could include in your project and your work. You could include peer support groups and activities in a group setting. You could also include activities for families and for young people with mental health concerns, including expanding existing work into new settings. And your project may include training for staff and volunteers, or capacity building, if you'd like to broaden out your reach and broaden out the work that you already do. That's something that would be eligible with this fund. You could also fund activities focused that increase awareness and challenge stigma around mental health support. We can also fund activities focused on asset-based community development and evaluation, supporting engagement and empowerment of local people from ethnic minority groups. Your project could include projects and activities which enhance and support mental health decision making and choice, thereby achieving better outcomes. So again, it's going back to that awareness and accessibility. We can also include use of new technologies and different ways of connecting with local people from minority ethnic groups at risk of developing or have mental health concerns. You could also do use of creative approaches to engage and support local people within the community. And you could also be eligible to fund a mental health professional to offer support in your setting as well. So there's quite a few different options there. We understand that you know your communities best, and you'll understand what their individual needs are as communities. And we ask that you plan your project and think about the need and the issue that you'd like to address, and what will you do to address those needs and issues, what will the impact and outcomes be, how much will it cost, what do you need, and to include that in the budget, and to include all of that to deliver a successful project. Just a few notes about the budget as well. Match funding can be included with this fund, and we ask that you just pop a note there to say if it's been confirmed or if it's still waiting to be confirmed. And you can use the grant to full cost recovery. So this can include management costs, overheads, utilities, things like that you need to deliver the project. Staff costs as well, they're eligible for this fund, and we ask that you pay the real living wage. And we can also include costs that make your project or your work accessible and inclusive. So this could include volunteer expenses or expenses for the beneficiaries, things like transport or food and childcare as well. We can also include evaluation costs as well. So if you feel like it would make much better impact and learning to have an external evaluator come in, then that would be eligible as well. And the grant themselves, so the minimum request is £5,000 and over 2 years. It would be split, so it'd be £2,500 each year. The maximum grant is £20,000 over 2 years, so £10,000 each year. And only one application per organisation can be considered. However, a partner organisation, they can be named in more than one application. I'll go through a bit about the decision-making process as well. Leeds Community Foundation, we will recruit an independent panel for this fund, and we'll liaise with our partners, third sector organisations, and relevant partners to ensure that our decision panels are fair and that they're diverse. This helps to ensure that panels' considerations and discussions are representative of the third sector, the communities that we are serving, and the specific aims of the funding programme. The panel's role, once they've been recruited, is to bring an understanding of local and strategic issues. Final decisions during the panel are by a majority vote, and LCF, Leeds Community Foundation, grants staff and managers will be present at the panel meeting to support and facilitate those conversations and those deliberations to ensure that it's fair and that we're keeping in line with the panel process. Just to note, the majority of our funds do tend to be oversubscribed, so we always try to ensure that constructive and clear feedback is given to all applicants. But just to note that we do expect this one to be oversubscribed too. I'll go through a bit about the reporting and evaluation for the fund. There'll be some further information provided to successful applicants as well regarding the evaluation. But monitoring end of grant report templates, they're found on our website under our grants monitoring page. And we are particularly keen to understand the impact of this fund. All organisations that are awarded a grant will be expected to complete an end of grant report, and that will capture the information about what you've achieved, what you have learned, what the outcomes have been, and what the challenges have been as well. It's important to recognise it's not a test. It really is about learning, so that we can then support you as third sector organisations and support the communities as well. So we really want to get a good sense about what has been achieved for beneficiaries, but also for you as organisations. It's a good opportunity with evaluation as well to think about the learning. I guess this will come into the application stage as well, to think about how you will evidence that learning and how you will demonstrate those outcomes. Consider the project's planned outcomes, the success measures that you'll use, how the outcomes and impact will be captured. And again, you can include evaluation costs within your project budget in your application. And you may wish to capture the project's impact through evaluation tools such as qualitative case studies or quantitative pre and post questionnaires. And please do include case studies, beneficiaries' feedback quotes, photographs, video links, and things like that. But we please ask that you gather the appropriate permission before sharing with us. And we are really keen to see the stories as well. I know that sometimes evaluation can just be about the numbers, but especially with this fund, we really want to see the impact that the fund and the grant has had for individuals and communities in terms of mental health. Okay. I'll go through the timelines for the fund. So the deadline is Monday, the 20th of January 2021 at 12 noon. Once the deadline has passed, the applications we've received will go into assessment phase, and that will be completed in February 2021. Then the decisions will be sent by email week beginning 8th of March 2021. The grant payments will be paid then in the next few weeks, and there's a 6-week window to accept the grant offer. So we expect grant payments to be paid mid-March to April, end of April. If you've applied for multi-year funding, then the grant will be split into equal yearly instalments. So the interim and final payments, interim payment will be in March 2021, April 2021, and August 2022. So that's just a bit of information about the timelines for this fund. At this moment, we are working in partnership with Leeds City Council Public Health, and we are working closely with Delvina Saunders, who will be able to provide application support and advice. So I'd like to take this opportunity to welcome Delvina Saunders to do a short, brief introduction.
Morning, everybody. I'm Del. So my role is the BAME Mental Health Inequalities Project Coordinator. I'm still very new to this role, but my role is very vast and covers quite a lot of things. And a part of that is to be involved with this grants programme. So if anyone has any questions about what needs to go into the application, or if they get a little bit stuck, please do reach out to me. I'll also put my work number as well in the chat, just in case you want to have a conversation with me as well. So we're really passionate about this, and we really do want to make a difference within the community and see some sort of progression within mental health in ethnic minorities. And a part of my role is, along with part of this grants programme, is looking at how we can reduce those mental health inequalities by bringing the community and professionals together to be able to come up with some solutions to be able to see some progression within our community and within people that are struggling. So I'll put my number in here now, and if you've got any questions, please give me a shout.
Thank you, Delvina. So that's the end of the presentation. I know it's been quite a lot of information, a lot to take in, and there's quite a lot of different streams to this fund to meet the aims of improving and increasing access for mental health support. I'd like to open the event for Q&A, which will be led by myself and Shahed. If anybody has any questions, then please feel free to pop them either in the chat or yeah, feel free to ask away.
There's a question from Kay. How many grants do you anticipate will be made? We're looking to distribute around £250,000 in total. Obviously, it's going to depend on what people apply for, whether they apply for £5,000 or 20,000. But we do see this program continuing for a number of years as well. So obviously, depending on funding. So yeah, we've not got a definite number, but it's going to be around 250,000 in a year at least.
Just to note as well, that grant pot hasn't been split. We're going to wait to see what applications we receive. So we want to have a nice split of groups that work with young people and families and adults, but we've not salami sliced the grant pot or anything like that. I'd like to see what applications come in first. And there's a question here, what will make a strong application? A strong application, I think the main thing is to always refer back to the criteria. A strong application as well is to be quite specific, I think. So be very clear about the needs and issues that you'd like to address. And you can use an opportunity to provide knowledge that you have as a third sector organisation if you've experienced an increase in support and a demand for work. And then to be very clear about what you would like to do to address that, and be very specific in your application. So, for example, if you're going to plan to do mental health workshops, be very clear about how many you'll be doing, what the duration is, how long they'll last for, whether it's weekly or monthly, and the beneficiaries number that you expect as well. And yeah, if you are working very in-depth with a vulnerable group, then we understand that you're not going to have a massive beneficiary number. So I guess it's just about being honest, and it's really about the impact. So we want projects to have a really good, clear, strong impact and outcomes in terms of improving mental health within ethnic minority groups, and also increasing the access to support and awareness as well of mental health support within communities. But we trust that you will understand the best way to meet those needs and issues in the communities. But again, if you do want to just run by a project, you can either contact me or Delvina as well.
Hi, I think there's a question here from in the chat. Just looking, sorry. Yeah, from Joe. You're asking about the threshold of the £300,000 income. So that applies to individual applicants. So if you are a registered charity or an incorporated organisation, your income cannot exceed 300,000, because the fund, through the fund, we're primarily looking at targeting the smaller organisations. But if you are part of a partnership application and you are the kind of lead applicant, then your income can be any size. But obviously there are restrictions in terms of the amount of money that you can secure from the grant. So you could potentially have an income of £1 million and be the lead applicant in a partnership application. But the maximum amount of the grant that you can then secure for your own organisation will be 25%. And 75% of the funds would then need to go to the smaller partner organisations that you're supporting. Hope that's clear. Are there any other questions?
There's one about the income. Do all the partners then have to have an income of under 300,000? Shahed.
Yeah, obviously. But if you're the kind of lead partner, you can have an income exceeding 300,000. That's only for the partnership application. If you're applying by yourself and you're a registered charity or an incorporated organisation, not a partnership application, but an individual applicant, then your income needs to be no more than 300,000. It can be more than that if it's part of a larger partnership organisation, partnership application. Yeah, the income's based on the last financial year or most recently audited accounts. That'll be fine.
So there's a question about, can you be the lead and sole bidder? I'm just thinking, would it help if I go back to the partnership part of the eligibility, just to sort of go through the income thresholds again? So if you're unincorporated group, the maximum that you can apply is £5,000. Partnership applications, larger organisations with any annual income, they can apply as the lead and they would be responsible for distributing the grant. They would take 25% and then the rest would go to the smaller organisation. So that's really to sort of support those groups that would be ineligible if they're in an unincorporated group, for example. And it just enables them to be able to, you know, be part of this fund and also to deliver the work that they currently do. If you're applying as a solo applicant, you must have an income of less than 300,000 in the most recent financial year if you're registered or incorporated. Unincorporated groups, if you're applying as a solo applicant, must not have an income exceeding £10,000 within the last financial year. Thank you.
There's a few other questions. Yeah, Kay's asking, can you be a lead and a sole bidder? Are you talking about two applications? Or are you talking, yeah, it's only one application per organisation, but you can be named in a partnership bid multiple times. Can you build on existing work, or does this need to be something new? It can build on existing work, I think it's fine. We're not expecting everybody to create something that's never been done before, and this word innovation keeps getting thrown around. It's got to be innovative, whatever that means. I think as long as we're more bothered about the impact and the kind of outcomes that you're going to be achieving, rather than it being completely new. But obviously, if it is new, brilliant. Let's test it out. Can organisations work with religious organisations? Yeah, as long as it's not kind of promoting kind of religion in any way, that's fine. It can be it can be worked with mosques, temples, churches. That's absolutely fine. Can it be based on current financial year, which has been substantially reduced? Well, the criteria said it's the last financial year, so whenever your last accounts were made, basically we'll go on that. Is there a particular thing you're getting at there, Alison? Or not?
Yeah, I think it's like just important to know we understand the impact of COVID-19 has had for organisations. So if your income has decreased or increased, as Shahed was saying, we take into account your financial accounts, your last audited financial accounts.
Can I just ask as well, without tapping on the phone? Hi everyone. Just a quick one. We can see everybody's tapping away, and there's a nervousness because grants to BME communities are very, very few, and often smaller organisations don't get them, in my experience. And I classify LIP as a smaller partner within that financial envelope. But can you give us some confidence that you're going to look at bids with detail, and some may be a bit wacky, and some may be about just engaging with communities to get the message out? You talk about stigma, because a lot of us, I assume, have got lots on, and we don't want to put our energies into bids that are, likely more than ever historically to be unsuccessful. So from our perspective, happy to look at this, but we need to know that we've got a fair chance at getting something out of this. And also, I see a lot of partners on this group that could liaise with LIP, and happy to work with anyone on this group to partner up and see if we can put a bid together with you. So a couple of things there. One is about you giving us some confidence. Look, guys, put something in. It's going to be looked at properly. It's not the same old funding panel that decides things, and I've been on those funding panels. And secondly, if anybody wants to partner up with LIP, like David says, please do get in touch with us. We'd like to come out with something creative.
No, I mean, definitely we're going to be working with public health and our partners who are also funding the program, and that's one of the reasons why the program was actually devised in the first place, because there is that recognition that there is that inequality in the mental health field, particularly for minority ethnic groups. So we particularly welcome applications from all sections of society. And as far as the panel's concerned, that'll be kind of put together at a later date, and we'll kind of consult with third sector organisations and with the funders as well. Make sure that there are relevant people on there that have got that lived experience, from those communities, as well as the kind of stakeholders and partners that work in that area. So we have that kind of technical expertise as well as the kind of lived experience as well. So we'll try and make it as diverse and as inclusive as possible. And yeah, I'd welcome all kinds of applications from all sections of the community, really. I don't know if that gives you any additional confidence, Jack, but yeah, please do submit.
I think as Joe would say in my team, let's hope and see, because all these organisations are doing a fantastic job.
Yeah.
But because we don't have fundraisers, we're not scaled to do it. We do tend to not secure as much money as the bigger providers.
Right.
That's something your colleague mentioned, and I think it needs to be factored in.
Definitely. And I think Delvina can probably help as well with the kind of funding applications as well. She's there to provide the support in the way that she said as well. So, we will be able to provide that application support and ensure, it's not just the usual suspects getting the funds. Obviously, we will try and kind of get a good spread, I guess, in terms of the applicants, and looking at different topics and hopefully looking at a balanced portfolio as well, because we don't want all applicants to be kind of working on the same thing. We need a good kind of spread across geography, across different themes as well, and some might be quite innovative, others might be existing work that can be developed. So yeah, small grants, large grants. Yeah.
Thanks, Shahed. There's a question here. What if you're a startup company and haven't yet filed financial accounts? Would you still be able to apply? You are still eligible to apply. We do fund new groups, startup groups. If you don't have financial accounts, you can provide a spreadsheet, and the spreadsheet should list your income and your expenditure for the year or how many months you've been open. And the main thing is as well is to have a bank account in the name of the organisation with 2 unrelated signatories. But yeah, you're still welcome to apply. And there's a question, if groups want to offer in partners or in partnership, can you help bring them together or know about each other? Yes, we can. We're not able to give out, email addresses, things like that, but we can help connect if we see that, you have similar work or you're in a similar patch. We can help link you in. And again, our colleague Delvina will be able to help bring organisations together as well.
Helena?
Really good point on different ways of working, isn't it? And not hurtling into something that looks similar to what it currently looks like.
Yeah. Mirav, I think you've got your hand up.
Of course, it's disappointing to hear.
Yes, something is very weird here.
Sorry,
the sound. What I was going to say is that we can help as Forum Central to bring organizations together and to give the information to any organization that will get in touch with me. We're very keen to see the smaller organizations getting these funds into their work.
Okay, that's great. Thank you very much for that offer. There's a question about COVID. If COVID is still as much a threat to us as it is now, then how does that affect the size of the groups we can work with? We would prefer to avoid Zoom sessions and get in the space face-to-face to deliver. I think as Helena mentioned in the presentation, we will try and be as flexible as possible and be accommodating of that. It might be that you can kind of change the way that you're delivering, and if it's suitable, move provision online if that's something that you think might be effective. If not, we can look at changing things like timelines and maybe kind of deferring some activity till later. But we can have those conversations if and when you are successful, and how the kind of ongoing situation and social distancing measures might impact upon the work that you're planning or had planned, and we can look at that, I guess, in the mix.
Shahid, there was a question earlier, I think we might have just missed it because I can't go back up to it, but it said, will this be able to fund existing projects that are going on, or does it have to be something completely new?
Yeah, I think I answered that earlier, because it's a question around innovation. Everybody wants innovation, but it's not always possible to be innovative. And I did say that I think the key thing is about the impact that it has and the kind of change that you're making in the mental health field, particularly in relation to inequalities being sort of experienced by minority ethnic groups.
Yeah.
So yeah, it can be innovative, and we'd welcome that. If you're doing something completely brand new and you want to test something out, that's great, and we'll welcome that as well. But it doesn't necessarily need to be innovative. It can be existing work that you're doing, and you might want to secure a grant to maybe develop it in a slightly different way, or to reach more people, or do things slightly differently than what you're doing. but it can be existing work for sure.
Yeah. If it is existing work as well, just refer back to the criteria, and as long as you're meeting those main aims, the one of the following: building capacity, reducing stigma, increasing trust, increasing access to early intervention, and influencing positive community action, then yeah, it's perfectly fine.
We're looking for community-led kind of social solutions addressing mental health inequalities. So we're not looking for like medical and clinical interventions, which people might think that they have to do something, you know, in that area. We're looking at something which is going to be slightly different, and you know, third sector organisations, community groups can get involved, and it could be a whole host of things as long as it addresses this quite broad criteria that we've got. You know, does it build trust in some way? Does it reduce stigma surrounding mental health? You know, it could be activities that you planned. It could be dancing, or, you know, it could be anything to kind of bring people together and overcome this issue. So, you know, you can think quite broadly. Are we done? I think I don't think there's any others, is there?
There's a question here. Please define community lead. Is that in reference to the applicant?
I've no idea. Kathy, do you want to clarify that, or is that in relation to something? Or community-led projects. So you know, ideas coming from the community that's kind of engaging, you know, the residents and potential beneficiaries in the solution, as it were. So it's either coming from a community organisation or the people that they're working with, and involving them in kind of, you know, coming up with the ideas and the solutions that you're proposing, rather than it just being kind of something that the organisation has thought of and, you know, think it's a good idea and communities alike. So involving and engaging the community in that way, yes, that's what that means.
There's a question about proposed budget. Can this vary depending on social distancing and COVID rules?
Yeah, sure. I think so. Yeah.
Yeah. And I think as well, we do take into account the beneficiaries number as well, because we understand there is that element of social distancing. And if you're running an activity or work in a community centre, then we don't expect you to have hundreds and hundreds of beneficiaries. And again, that can be reflected in the budget as well. Any other questions?
I mean, if there are any further questions, you can always, you know, get in touch afterwards as well, you know, via our grants inbox, or you can contact Delvina as well for any questions in relation to the applications, or if you need any support with that, then by all means do that as well. But yeah, good luck to you all. Okay.
Thank you everyone for attending today. It's been really nice to connect and to see everybody, and this is a really, you know, exciting, interesting fund. It has massive potential to really support and reach people from minority ethnic groups. So yeah, if you, again, as Shahed was saying, if you do have any questions, read through the criteria, think about your proposals, and then if you do need to discuss it or go through it, you can contact LCF or Delvina Saunders as well. And yeah.
Thank you very much, everybody.
So much, everyone.